The oral exam in the awake patient begins by observing the patient from a distance. Assess the head for symmetry. Look for any swelling, draining tracts, or other lesions present on the face. Visualize the external surface of the lips and check for any abnormalities or asymmetry. If the animal is visibly drooling or hypersalivating, make a note of it. Palpate the ramus of the mandible on both sides of the patient and the mandibular symphysis. Also palpate the temporomandibular joints, as well as the mandibular lymph nodes and salivary glands. To begin the closed mouth portion of the oral exam, make sure your patient is properly restrained. Place one hand under the patient's chin to keep the head lifted. Using the other hand, gently raise and separate the lips until the teeth and gums are clearly visible. Examine the buccal surface of the teeth and gums as well as the inner surface of the lips or labial mucosa. A few common abnormalities to watch for would be chronic ulcerative periodontal stomatitis or cups lesions, redness, edema, bleeding, gingival hyperplasia, masses, and gingival recession. Assess the crown status of the teeth and check for tooth mobility. Watch for abnormalities such as tartar, missing teeth, retains deciduous teeth, enamel hypoplasia, enamel infractions, pulpitis, resorptive lesions, fractures, and attrition or wear and tear. Assess the 5 sites of occlusion. These sites include midline match, incisor overlap, canine interlock, premolar interdigitation, and carnasial overlap. If any misalignment is present, check for signs of damage to the surrounding soft tissue. If the animal has noticeable halitosis, make a note of it. The open mouth portion of the oral exam is typically the least tolerated by the patient and should generally be saved for last. For small canine patients, use one hand to grasp and tilt the head backwards, and use the other hand to gently but firmly push the lower jaw down. In larger canine patients, use one hand to grip the upper jaw behind the nose. Use the other hand and insert a thumb behind the upper canine tooth and press on the hard palate to encourage the dog to open their mouth. Then, grasp the lower jaw and pull down. While opening the jaw, take note of the patient's jaw tone or strength and watch for any signs of pain. For feline patients, use the same technique you use for small dogs. Use one hand to grasp the head and tilt it backwards, and use the other hand to gently but firmly push the lower jaw down. Keep in mind that you may only get a very quick look into the mouth, so it's important to know what you're looking for. Quickly examine the hard and soft palate, oropharynx, and tongue. Some things to watch for would include cleft palate, masses, ulcerations, or other signs of inflammation. You may also be able to check for foreign bodies such as strings, which can get caught on the teeth or wrapped around the base of the tongue.